back to complete this assessment, and because the video stopped in between and we weren't sure what we missed, we're going to go ahead and start with the mouth and the throat again. And I am going to assess the lips, the gums. Can you open, please? Thank you. Okay, upper and lower, and tongue lift. Okay, push. And at the same time, we're going to be assessing the cranial nerves. Can you stick your tongue out, please, and say ah? Uvula rises and is centrally located. And can you stick your tongue out, please? Beneath the circulation? Great. Okay. I'm going to also assess his cervical nodes and his posterior cervical nodes, as well as the posterior auricular nodes along the mastoid process. Any pain or discomfort? Okay. I'm following the posterior cervical chain. And now I am going to do the anterior cervical chain for any nodes, and I'm doing the supraclavicular, infraclavicular, epitrochlear nodes, and any axillary nodes. Okay, very good. And at this time, I'm also going to have him shrug his shoulders. Go ahead, push your shoulders up. Thank you very much. And that's equal. Could you push against my hand, please? And again, here, any pain or discomfort. Okay, I'm also going to check for any strength in his muscles in his hands. Make sure, can you spread your fingers for me? Okay, can you close them? Okay, great. Can you raise your hands above your head? Okay, down to the side and down. Any pain or discomfort? Very good. Okay, so at this time, I've checked for the neck and range of motion. He's turned his head. He showed me he can move his shoulders. And so at this time, we are going to go ahead and we are going to listen to his heart. And I'm going to check for bruits. Following that, I am going to assess his lungs. So, I'm going to start with the pulmonary artery. Just breathe normally for me, please. Okay. Tricuspid, aortic, and the mitral valve. I hear normal S1 and S2. I'm going to also check for carotid bruits. Hold your breath for me, please. Breathe. Same thing again. Breathe. Okay. I hear no carotid bruits at this time. And also, I could actually assess for temporal bruits, temporal artery bruits. Do you have any pain or discomfort in this area? No. Okay, now we're going to assess his lungs. And I'm going to start in the posterior upper lobes. Okay, I need you to take a deep breath in through your nose and out through your mouth. Again. Okay. Again. And we're doing symmetrical, side to side, to compare. Okay. Okay, and we're going to do the same thing in the front, starting at the apex. Big breath. Right out. Again. 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 And now axillary, mid-axillary area. Very good. Okay. Very good. Okay, I'm also going to check for bronchopneumy and for whispered petrically. Okay, and at this time, okay, and I want you to whisper and tell me right now, I want you to say 99. You can say it louder.
Oh, 99.
99.
99.
Okay, I hear no fremitus and feel no fremitus. Again.
99.
Okay.
99. 99.
And I'm going to listen. Again.
99. 99. 99. 99.
Very good. All right, and now I'm going to have him do egophony, and you're going to say E.
E.
Right?
E. 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 E.
normal air movement, showing no signs of consolidation. Okay, I need to check his thyroid. In order to check his thyroid, I would like for him to swallow. This is a clean and fresh bottle of water. Okay, and if you, whoa, scoot around just a little bit because I need to, okay. And I'm gonna, right here, I'm gonna assess as you swallow. Go ahead. Swallow. Very good. Okay, the thyroid moves up and down smoothly. I did not feel any nodules in the thyroid gland. Okay, thank you. Okay, so at this time, I'm gonna have him lie down. So you kindly lie down for me. I'm gonna inspect the abdomen. I am gonna also evaluate for renal bruits. I'm gonna listen for at the aorta and also at the iliac arteries. All right? So we auscultate first after we have inspected, and so I'm looking at the contour of his abdomen. And he's nicely concave, there's no distension. As you can see in the abdomen, I don't see any major protrusions. His chest is symmetrical, the movements are symmetrical, and so at this time I am going to start using the 4-quadrant method versus the 9-quadrant method for auscultation. I'm going to start at the right lower quadrant. You should listen for 3 to 5 minutes in each area for clicks and gurgles. His umbilicus is central and midline. I am now going to listen for any renal arteries, bruits. Hearing none for the aorta. The iliac. Hearing none. Next, I am going to palpate. And I'm going to palpate first using light palpation in all 4 quadrants. Any discomfort? Also observing the patient to make sure I don't see any facial grimacing or pain or discomfort. After I do light palpations, I'm now going to do deep palpations. So, any discomfort? Feeling for any abnormal protrusions in the underlying organs. Okay. Next, I am going to assess for the liver span. And I have my tape measure in which to do so. And my skin marker, I will do so through percussion. So I'm going to use my plexi finger, and I'm going to measure starting at the ribs. So when I get to my first sound, I know that I'm reaching a dull sound, no longer the flat sound that's over bone, and I can continue. Until I get my change in sound. And I'm going to do the same thing. I'm going to measure it. Okay, that's 6 inches. And I'm just going to mark it on the table so that I don't lose that information. And also midpoint. Starting over the xiphoid. And we mark it. And my liver span is 6 by 3.5 inches. I did not hear any bruits in any of the areas. The next thing I'm going